Hi, I'm Dr. Gulledge, and I'm the Chief Medical Examiner for Cobb County. We're about to take a walk through our new medical examiner's office and get a chance to see where the doctors and staff of the medical examiner's office work. So when our transport service or other transporters bring us a new case, they come into our Sally port where the decedents can be offloaded and put directly into one of the coolers. As we walk through, our system is designed to be very wide, where we can manage two cases at once, somebody coming in and leaving, or two cases coming in, or two cases leaving. The cases are weighed on our floor scale and then would be put into a walk-in cooler. In the mornings, those cases will be brought out. We work 24/7, 365. At any point, we're capable of responding to a death, no matter where it is in the county. And at that point, the next day, we will bring out the cases that have been brought in over the previous day for an examination. We do exams routinely 6 days a week, and sometimes 7. All of our entries into the morgue go through a biovestibule. Our morgue is considered a biohazardous area because each decedent may have diseases that we don't know about. So as we walk into the morgue, the main autopsy room, you can see we have 4 autopsy stations that are routinely used. The video monitors on the wall are designed to project x-rays, whole body x-rays, so we can see the decedent all at once. The surgical lights are there to provide additional lighting inside the decedent in dark areas that the standard lighting is not able to reach, or to provide additional light to any other point that needs to be there. We have a body lift directly above that is capable of lifting up to 1,000 pounds. We haven't had a 1,000-pound decedent, but we've gotten quite close. This allows us to manipulate them without hurting ourselves. We store all of our tissue and toxicology samples on site. However, our toxicology testing is done at an outside laboratory. Very few of our tools are particularly specialized. We do use a bone saw, which is similar to a cast saw, but otherwise we use scissors and knives and forceps, just like some of which would be at home in a kitchen, most of which would be at home in a surgical pathology or a hospital pathology room. When we look at advances in forensic pathology over the past 100 years, probably the largest advancement was the power bone saw. Refrigeration and radiographs have been around for much longer than 100 years. But it's important to realize that as a forensic pathologist, our most important tools are our eyes and our brain and our hands. There is no magical device that you can stick a decedent into that tells you the answer. The answer is discovered by learning, by seeing, and by doing, not by some analysis done by a machine necessarily. But we do have a really spiffy new machine that I'd love to show you. Radiography has been around for over 100 years, but whole body radiography has not been. It's only been around for the past 15 years or so. Maybe a little bit longer. It was actually developed as part of a South African diamond mines protocol for doing radiography on diamond miners, because as it turns out, it used to be quite common to steal diamonds by swallowing them. But since they're radio-opaque because they're so dense, it meant that diamond miners got radiographed quite a lot. So this company developed a whole body radiograph system for diamond miners and then found a good way to change it so that it was useful in the forensic setting and in the trauma setting. So this is the forensic model of our Lodox, which does an entire whole body X-ray in 14 seconds. And we use that for all of our trauma cases and all of our gunshot cases and anytime we think we'd like to see an X-ray. So it gets routinely used quite a bit. We're going to move into what is our special autopsy room. And our special autopsy room is used for cases which may be infectious, which may be decomposed, but we also have a station in here to work with skeletonized remains or neuropathology. And as you can see, working right now on a skeletonized set of remains. Obviously, not all of the bones are here, but a fair amount of them are. And so we will be determining the height and the sex and the race of this decedent based on skeletal characteristics. There are charts to measure the length of the femur to help determine the height of the individual. There are methods that we can use with the pelvis to determine whether the decedent is male or female. And there are cranial characteristics that help determine race or racial origin. As you can see, this is a single autopsy station and is used for, like I said, infectious cases. We do have the capability to broadcast to an observation deck for police officers who need to be present for their autopsy. We can keep them safe while we do it. This isn't a general education tool. It can be used for medical education, but we don't have a sign-up list for who gets to come watch an autopsy because that's not very respectful to the decedent. So we're back in the main autopsy suite. And to just sort of wrap up, forensic pathology is a unique position in government. I like to say that the medical examiner's office sits at the intersection of public safety and public health. So over the past year and a half, we've all been very concerned with the public health crisis that has been going on in the world. And the entire time, the medical examiner's office has continued to work to identify potential infected individuals who are dying as a result of their disease and certifying their deaths appropriately. But at the same time, we're still responsible for assisting public safety with determining whether a deceased individual is the victim of a crime or whether or not the death is natural. So without the medical examiner's office, the police wouldn't be able to do their job when it comes to investigating deaths. Without the medical examiner's office, public health wouldn't be able to do their job with accurate certification of death certificates and determination of the prevalence of disease in our population. And as rarely as we interact, without the medical examiner's office, the district attorney probably wouldn't really be able to take a homicide case to trial because there's too many unanswered questions without the medical examiners becoming involved in the case. So in that unique position, we work very closely with the district attorney, we work very closely with all of public safety, we work very closely with all of public health, and provide information to those organizations. But beyond that, we're involved with the local hospital's trauma service in giving them feedback on ways they can do better or how they did good in the process. We're also involved intimately with organ donation and procurement, making sure that life-saving organs reach the people that need them. We also work very closely to get tissue donation, corneas and bones to people who need them. So the best thing about my job is that I don't do the same thing every day. Some days I'm in here all day, and some days I'm working with the health department or working with the police department or working with the district attorney to try and make sure that the information we have found is making it to the people who need it. And of course, daily we work with grieving families to make sure that they have the closure that they need for their loved one. Thank you for taking a walk through our morgue with us.